Mr. President, I rise today to talk about health reform. And I'd like to start by telling you the story of a little boy named Isaac. From the day his parents brought him home as a newborn to Isanti, Minnesota, he was sick all the time. He had everything from the flu to bronchitis to ear infections, but unlike most little boys, Isaac never seemed to get better. His parents, as any parents would, did everything they could to help him. They brought him to every medical specialist they could think of, but no one could figure out what was wrong. Finally, Isaac was diagnosed with a rare disease called common variable immunodeficiency. This means that every 2 weeks, a nurse has to visit his home to give him the medicine that lets his body fight off germs. Without this medicine, Isaac's body can't fight off even a common cold. The home visits and IV medications that Isaac needs are expensive, but Isaac's parents had health insurance, so Isaac was able to have a normal childhood. Today, Isaac is a 19-year-old college student in Minnesota with dreams of becoming an English teacher. Here's a picture of him. He's the one on the right. That's Isaac. Because of the toll his illness takes, his family decided that Isaac should go to school part-time. Unfortunately, before the health reform law was passed, young adults over 18 years of age generally had to be in school full-time to stay on their parents' health insurance. And if Isaac hadn't been able to stay on his parents' health plan, he would have been in a tremendous bind. His disease is the definition of a pre-existing condition, and it would have been nearly impossible for him to find affordable individual coverage. But because of the health reform law that we passed last year, Isaac can now stay on his parents' health insurance, regardless of his school status, through his 26th birthday. He and his family were able to make the choices that made sense for their family without having to worry about Isaac's health insurance. And in fact, in a few years, when he turns 26, a key provision of health reform will have kicked in, and insurers will no longer be able to discriminate against him or any American because of a pre-existing condition. Isaac's parents may not be doctors, but they are experts when it comes to the needs of their family. And they know the truth about what the health reform law has already done for their family. And just like Isaac's family, Minnesotans may not know every word of the health reform law, but they are experts on what they need for their own families. Let me tell you about another Minnesota family that learned about the benefits of the new law. Maya, who you can see right here, is one of 3 million Americans with epilepsy. She had her first seizure when she was just 3 years old. Modern medicine has not yet been able to find a way to stop her seizures, but by taking 5 medications per day, she can control them. Recently, Maya's father was laid off and the family lost his health insurance. Maya's parents suddenly had to confront the possibility they would no longer be able to give Maya the medications she needs to fight her daily seizures. Without insurance, Maya's medications cost more than $1,500 a month, which would quickly bankrupt her family. Losing a job is stressful enough. But before the health reform law, Maya's parents would have had to worry about buying health insurance on the individual market, and because of Maya's pre-existing condition, that would have been almost impossible. Fortunately, the health reform law has banned insurance companies from discriminating against children with pre-existing conditions. And so her family was able to get onto another insurance plan without being denied. The diagnosis of a chronic illness can happen to anyone at any time. Often, like for Maya, it doesn't happen because of a lifestyle choice or genetic predisposition. It just happens. Maya was 3 years old when she was diagnosed. And paying for essential medications and healthcare services that help control chronic conditions like Maya's can easily put a hard-working family into bankruptcy. Medical costs are the cause, wholly or in part, of 62% of all bankruptcies in this country. That will change dramatically because of this law. Americans will no longer be discriminated against because of pre-existing conditions, and insurance companies can no longer impose lifetime limits on the dollar amount of care that they will provide. This is an enormous, almost incalculable benefit to Americans and their peace of mind. The truth is that Congress listened to people across this country. People like Isaac and Maya and their families, by allowing kids to stay on their parents' insurance longer. We listened by ending insurance companies' discrimination against women and people with pre-existing conditions. And we listened when the American people said that lifetime caps on insurance benefits were forcing millions of chronically ill Americans into bankruptcy. The people of Minnesota believe, as I do, that a family that works hard shouldn't be financially ruined if their kid gets sick. When I was campaigning, I heard this again and again from families across Minnesota, and I was listening. The people asked this Congress to find a way to make health care affordable for everyone, and we did. Now, the insurance companies and their political allies want you to believe that the only way to keep your premiums low is to cap the amount of benefits that you can receive in your lifetime, but this is just not true. In the health reform law, we work hard to slow the growth of health care costs without abandoning the over one-third of American adults who struggle with chronic disease.